Those numbers are creating a tough task for the state's COVID Comm system.
It was created back in December to find available bed space for COVID patients, but the program director told THV11's Mercedes McKay the difference between the winter months and the current summer months are night and day. And
Mercedes joins us now from the COVID Comm headquarters. Mercedes, why does the director believe that this surge is worse than we saw this winter?
Rolly Marlisa, the director says even though in the winter months they were actually coordinating more COVID patients, the job is more difficult now because of longer ICU stays and lower hospital staffing.
It is the recipe for the perfect storm, thus the problem that we can experience with placing COVID patients.
Jeff Tabor is the program director for the state's COVID Comm system, a job that brings more challenges day by day.
I would say almost from the beginning of the summer surge, it's been a different flavor, but the last couple of weeks have been more difficult.
Weeks that have been filled with hospitalizations and ICU admissions breaking records.
It's hard. It is very hard. The patients, it's a very different demographic. They're younger, and they are very much a sicker population.
The sicker the patients, the longer their ICU stay. This means fewer beds available and more possible patients transferred from state line to state line.
We've coordinated from Bella Vista to El Dorado, from West Memphis to Fayetteville, and all corners in between.
Colors of red and green fill the system's dashboard every day. Red meaning no capacity and green meaning availability. Tabor says those colors change a lot of times depending on when patients are discharged from the hospital.
We'll see in the mid-mornings to mid-afternoons the green starts popping up ever so briefly sometimes, and that's when we'll strike.
The fluid nature of hospital capacity is why the number of ICU beds available can change within hours. But according to Tabor, sometimes that availability isn't possible because of low staffing.
It's the housekeeping staff, it's the food services, it's the respiratory therapists, it's the phlebotomist, it's everything.
While this domino effect continues, Tabor says the community has to step up.
The public has skin in the game, right? Only the public can fix this.
Tabor says even though COVID is indirectly affecting the trauma system, so far they have successfully transferred every trauma patient without delay, so no patient has waited or gone without care. Live in Little Rock, Mercedes McKay, THV 11 News.